Today, we'll be looking at substance use briefly. My name is Dr. Boakye-Boama. I'm a medical doctor and a resident in the psychiatry department, Kumasi, Ghana. My email is peterboakye-boama27@gmail.com. Outline of the presentation. Each drug is treated under the following headings: definition, drug actions, signs and symptoms, adverse effects, investigations, screening tools, and management. The drugs of abuse we'll be looking at are 1. Alcohol, 2. Cannabis, popularly known as weed, 3. Tobacco, that's cigarette or nicotine, 4. The opioids, that's tramadol, pethidine, morphine, and heroin, 5. Red, that's tapentadol, popularly known as winning red, and 6. Cocaine. Let's start. Alcohol. The active ingredient in alcoholic drinks is ethyl alcohol. Drug actions. Alcohol has non-specific effects on neuronal cell wall fluidity and permeability. Alcohol's neurotransmitter-specific effects include enhancement of GABA-A transmission, which causes its anxiolytic effects, release of dopamine in the mesolimbic system, which causes its euphoriant and reward effects, and inhibition of NMDA-mediated glutaminergic transmission, which causes its amnesic effects. About 90% of alcohol metabolism takes place in the liver. Signs and symptoms of alcohol use. Immediate signs and symptoms of alcohol use include behavioral problems and mental changes. This include inappropriate behavior, unstable mood, poor judgment, slurred speech, problems with attention and memory, and poor coordination. Long-term signs and symptoms include high blood pressure, heart disease, liver disease, stroke, digestive problems, and weaker immune system. Now let's look at the adverse or negative effects of alcohol use. We have medical complications, psychiatric complications, and alcohol withdrawal syndromes. Let's look at them in details. Medical complications include acute toxicity, clouding of consciousness and coma, and risk of aspiration, hypoglycemia, or acute renal failure. Psychotic complications or psychiatric complications include alcohol-induced amnesia, alcoholic hallucinosis, Wernicke-Korsakoff syndrome, among others. For alcohol withdrawal syndromes, they can be uncomplicated or complicated. Now, medical complications of alcohol misuse in details. 1. We have hepatic problems like alcohol hepatitis and cirrhosis, gastrointestinal problems like hematemesis, Barrett esophagus, Mallory-Weiss tears, peptic ulceration, or chronic pancreatitis. There can be cancers like hepatocellular, esophagus, among others. Cardiovascular problems like hypertension and dilated cardiomyopathy. Respiratory problems like infections including TB, Klebsiella, and streptococcal pneumonia. Neurological problems like Wernicke-Korsakoff syndrome, peripheral neuropathy, among others. Then genitourinary problems like erectile problems, and others like fetal alcohol syndrome and gout. Now, psychiatric complications. Let's look at Wernicke-Korsakoff syndrome. We start by looking at Wernicke encephalopathy. Clinical features. There's an acute onset of a tetrad of 1, acute confusional state, ocular signs like ophthalmoplegia, and ataxic gait. The fourth one is associated features of peripheral neuropathy and resting tachycardia. Etiology of Wernicke encephalopathy. It occurs secondary to thiamine, that's vitamin B1 deficiency. Treatment. You give high potency parenteral B1 replacement, that's IV Pabrinex, over 3 to 7 days. And for outpatients, they can receive thiamine, tab-thiamine, 100 mg TDS for 1 month. Prognosis. Untreated, the acute phase lasts approximately 2 weeks, with 84% of cases developing features of Korsakoff psychosis. Now, Korsakoff syndrome. What is Korsakoff syndrome? It's caused by neuronal degeneration secondary to thiamine deficiency, and is most commonly seen in heavy drinkers. For clinical features, there's absence or impairment of ability to lay down new memories, together with variable length of retrograde amnesia. Treatments include oral thiamine replacement and multivitamin supplementation for up to 2 years. Now, 3. Alcohol withdrawal syndromes. Management of alcohol withdrawal syndromes is basically detoxification with benzodiazepines for tremors, anxiety, and to reduce seizures, antipsychotics for hallucinations or delusions and cravings, then supplementary vitamins to prevent Wernicke-Korsakoff encephalopathy, then thiamine TDS for maintenance. Investigations in alcohol use include breath tests, blood tests like CMV, GGT, urinary tests, cognitive testing, and physical examinations for signs of usually stigmata of liver disease like palpable liver edge, jaundice, spider nevi, and others. It's worth noting that 1 unit of alcohol contains 8 grams. The number of units of alcohol is calculated as volume in liters times percentage of alcohol. Screening tools for alcohol use include the CAGE questionnaire, which is here. Management of alcohol use includes techniques of controlled drinking, which are shown here. Management of alcohol abuse, use of medications. We use anti-craving medication like acamprosate, naltrexone, and baclofen. Disulfiram can also be used. You can read the details which are written here. 2. Cannabis or weed. Cannabis is the most widely used illegal drug. It comes from cannabis sativa, mostly. It contains 60 psychoactive cannabinoids, the most important of which is 9-tetrahydrocannabinol, THC. Drug actions. Cannabis is metabolized to active and inactive metabolites, and their absorption into fat means that urine tests remain positive for up to 4 weeks after regular drug use. Signs and symptoms. The immediate effects of cannabis use include mild euphoria, that's the giggles, a sense of enhanced well-being, a subjective sense of enhanced sensation, relaxation, altered time sense, and the appetite increase, that's the munchies. Physically, there is mild tachycardia, dysarthria, and ataxia. Adverse effects of alcohol use, that's the short-term side effects of marijuana use include euphoria, impaired memory, disorientation, and confusion. The long-term side effects of marijuana use include respiratory difficulties, pregnancy-related risks, severe nausea and vomiting, psychiatric disorders, addiction, and increased use of other substances. Investigations include drug testing in urine, blood, and saliva to detect THC. Screening tools for cannabis use are written here. Management of cannabis use includes cognitive behavioral therapy, family therapy, psychoactive treatments for anxiety and sleep disorders and pain, the management of comorbid disorders. To prevent all these, abstinence is recommended. tobacco or cigarette or nicotine use. The main neurochemical in tobacco is nicotine. Drug actions. The most important metabolite in nicotine in most mammalian species is cotinine. Drug action includes two steps. The first is mediated by cytochrome P450 system. The second is catalyzed by aldehyde oxidase. Signs and symptoms of nicotine use include fast heart rate, increased blood pressure, nausea, headache, dizziness, and restlessness. Long-term side effects, symptoms and symptoms of nicotine use include respiratory problems, cardiovascular diseases, reproductive issues, among others. For the withdrawal symptoms, there is depressed mood, insomnia, irritability, anxiety, anger, cravings, decreased heart rate, among others. Adverse effects include elevated heart rates, blood pressure, dizziness, headaches, which are immediate, and long-term side effects include heart attack, stroke, and cardiovascular diseases. There's also perinatal and postnatal disease like miscarriage. Then secondhand smoking can lead to asthma and environmental risk of causing fires. Investigations for nicotine use include measuring nicotine and its main metabolite cotinine in blood samples, saliva samples, among others. Screening tools include cage questionnaire for smoking. Management of tobacco dependence include pharmacotherapy, where there's nicotine replacement therapy with patch, nicotine gum, lozenges, sublingual tablets, nicotine inhaler, and nicotine nasal sprays. The non-nicotine replacement therapy like bupropion and varenicline. 4. Tramadol or petidine, morphine, and heroin use. That's the opioids. Opioids are a group of chemicals derived from the opium poppy. That's Papaver somniferum. Drug actions. We have tramadol, petidine, morphine, heroin, and their various drug actions are written here. You can look at them in details. Signs and symptoms of opioid use include small pupils, drowsiness, loss of appetite, weight loss, but the most important are the opioid withdrawal symptoms which we use in management, including lacrimation, rhinorrhea, piloerection, that's a goose flesh, myalgia, nausea and vomiting, pupillary dilation, and autonomic hyperactivity, that's tachycardia and tachypnea. Adverse effects include immediate nausea, vomiting, constipation, pruritus, dizziness. Long-term adverse effects include liver, kidneys, endocrine damage, and risk of heart problems. Investigations include urinary tests done in intoxication and addiction, and other tests which are done when there's IV drug abuse, such as HIV, Hep B testing, among others. Screening tools for opioid use include the opioid risk tool. Management of opioid use includes interventions such as they shouldn't use opioids while alone, they should use it safely. Medications used to treat opioid addiction includes methadone, buprenorphine, and naltrexone. Now, red. Red is a synthetic opioid analgesic with dual mode of action as a highly selective full agonist of the mu opioid receptor and as a norepinephrine reuptake inhibitor. The mechanism of action of red is written here. Signs and symptoms of tapentadol or red use include headache, constipation, loss of appetite, dry mouth, which are the usual side effects even in therapeutic doses. Common tapentadol withdrawal symptoms include anxiety, agitation, sweating, insomnia, rigors, pain, nausea and vomiting, tremors, diarrhea, running eyes, among others. Adverse side effects include feelings of relaxation and euphoria, respiratory depression, addiction, and substance dependence. Investigations include detecting the drug and its metabolites in urine and blood samples. Screening tools are written here. Management of tapentadol use involves rehabilitation. Cocaine. Cocaine is a central nervous system stimulant. Drug actions It acts pharmacologically on serotonin, norepinephrine, dopamine reuptake inhibition.